Welcome to Heart Smart Series. I'm Whitney Tate. Emily Grabel, Nurse Manager of Cardiac Rehabilitation of Southeast Health, and Southeast Health Exercise Physiologist Chelsea Null joined us today to talk about cardiac rehabilitation and a new program for patients with peripheral artery disease. Thank you so much for joining us today, ladies.
Thank you for having us.
Thank you for having us.
Yeah. So what is cardiac rehabilitation and who qualifies for it?
So Cardiac Rehab is a safe, outpatient-based exercise program. Our goals through this program is to try and restore heart or lung function with our patients. Patients who qualify for this program are any patients who have had a cardiac event. So if they've had a stent, open heart surgery, valve replacement, we even incorporate our patients who've had heart failure into our program.
Emily, what services are included in cardiac rehab?
So the patients who join Cardiac Rehab all receive EKG telemetry monitoring while they exercise. They get blood pressure checks, rhythm checks. We keep a close eye on their blood sugars while they're in there. We also educate the patient on lifestyle modifications. So if it's smoking, we're able to counsel them on smoking cessation. We are able to talk to them about dietary changes, and we also can keep track of blood pressure home monitoring and exercise that they're doing at home.
Chelsea, what are the benefits of cardiac rehabilitation?
So cardiac rehab actually reduces the risk of another heart event by 25%, and it decreases the mortality by 5 years after the completion of the program.
Emily, where does Southeast Health offer cardiac rehab?
So we're very fortunate to have 3 cardiac rehab locations. We have a cardiac rehab on the Southeast Hospital campus. We have one in Sikeston, and we have one in Dexter at our Southeast Health of Stoddard County location.
Chelsea, what is the importance of exercise and activity for cardiac patients?
Yeah, so exercise actually helps reduce blood pressure, cholesterol, blood sugar, and even stress and anxiety, and these are all important risk factors when it comes to coronary artery disease.
Emily, can you tell us a little bit about the new program that's available for people with peripheral artery disease?
Absolutely. Recently, we have implemented a supervised exercise therapy program for patients with peripheral artery disease, or better known as PAD. These patients will walk on a treadmill until they have the point of pain in their legs. At that time, they will sit down, have a rest period, and then resume their walking program on the treadmill. Our goal is to decrease the patient's claudication symptoms in their legs.
How does a patient get enrolled in the cardiac rehab program?
Every patient is referred by their physician with an order. So the patients who have had open heart procedures, coronary artery bypass grafting, valve replacement, stenting, heart failure, those are all patients that we could accept into our program.
Emily, is there anything else you'd like to add today?
In addition to our cardiac and peripheral artery disease programs, we also have pulmonary rehab at our Cape and Dexter locations. Recently added Dexter Pulmonary Rehab to our programs. Patients who have underlying lung disease such as COPD, asthma, pulmonary hypertension, emphysema could all qualify for these programs that we have. And I'd also like them to know that the service that we provide is very special. We hit patients after they've had a major life event, and we can help them not only physically, but emotionally and psychologically. It's a wonderful program that we're able to offer to our patients.
Ladies, thank you so much for joining us today.
Thank you.
Thank you.
For more information about this topic and others, visit sehealth.org.